Flu plus coronavirus equals Flurona. What you need to know about co-infection experts are watching. Show Caption Hide Caption Flurona. What to know about co-infections with COVID-19 and the flu. Health experts expect to see more Flurona as flu cases rise and coronavirus cases continue to surge due to the Omicron variant. Just the FAQs, USA Today. Flurona. The name conjures images of cheap cable horror flicks, think Sharknado, but the flu-COVID dual infections are real. More cases are likely. And they're not nearly as terrifying as flying sharks, especially for people who are vaccinated against one or both. Texas Children's Hospital announced this week that tests confirmed a child was infected with influenza A and SARS-CoV-2, the virus that causes COVID-19. The patient was not hospitalized and is recovering at home, the hospital said. No other details were given. This is one confirmed case and, of course, we'll be working with our colleagues across the country to see if there are more cases and whether we will see a distinct pattern in these cases, Dr. Jim Versalovic, pathologist-in-chief and COVID-19 Command Center co-leader at the hospital, told reporters Monday. COVID updates to your inbox. Get the latest on cases, treatments, news and more. Sign up here. The announcement comes a few days after Israel reported its first confirmed Flurona case in an unvaccinated pregnant woman at the Beilinson Hospital in Petah Tikva, the Times of Israel reports. Health experts expect to see more Flurona amid rapidly rising flu and coronavirus cases, the latter being driven by the highly contagious Omicron variant. And this isn't the first time healthcare providers have seen co-infections of the flu and COVID-19, as well as other viruses. Texas Children's Hospital was also the first children's hospital in the U.S. to report a co-infection of COVID-19 and respiratory syncytial virus, or RSV, in the summer. Versalovic said dozens of children with co-infections required hospitalization. But there's no specific treatment or vaccine for RSV, so experts speculate children with Flurona may experience better outcomes. I expect to see plenty of co-infections, of flu and COVID, going forward, but I don't see anything that suggests it makes COVID infections worse, said Dr. Frank Esper, a physician at the Cleveland Clinic Children's Center for Pediatric Infectious Diseases. Those are two viral pathogens that we actually have medicines for. COVID-19, 10 cases diagnosed per second around the globe as year ends. The rise of the Omicron variant has led to a massive surge in cases during the last few days of 2021. Staff video, USA Today. In addition to life-saving vaccines to prevent severe illness, he said, healthcare providers are prepared to treat the infections simultaneously with Tamiflu and Remdesivir. Immunocompromised people are vulnerable to these infections, but co-infections are more likely to occur in young children, experts say, as their immune system is still unfamiliar with many of these common viruses. Hands down, the number one predisposition for having more than one virus at the same time is your age, and it's really children under 5, Esper said. They all have virus running rampant and swap them like trading cards. Cold viruses make up the most commonly seen co-infection cases, Esper said, whereas co-infections with influenza are observed less frequently. There are certain pathogens that don't like to dance with anyone, and influenza is one of them, he said. When the body gets infected with the flu virus, it really starts flooding the whole system with a lot of immune components that prevent viral infection, making it harder for other pathogens to enter the body and cause illness. Co-infections involving the flu may be rarer than other viruses, but health experts still expect to see rising cases of the Flurona as the U.S. approaches peak flu activity. According to the Centers for Disease Control and Prevention, only about 43% of children 6 months to 17 years have been vaccinated for the flu as of December 4th. CDC leader, flu shot doubly important this year. The message is clear: get your flu vaccine. The U.S. is gearing up in case of a bad flu season on top of the continuing COVID-19 crisis. Public health experts pleaded Thursday for Americans to get vaccinated against both. October 7, AP. Not 2020 again, tell that to parents where COVID cases, test shortages are closing schools. Vaccine resistance pretty proportional, skeptics doubted vaccines long before COVID, despite health gains. Texas Children's Hospital said it has diagnosed more than 90 flu cases since Thanksgiving. Meanwhile, weekly COVID-19 cases continued to double due to the Omicron variant. During the weekend, we shattered prior records that were established during the Delta surge in August, Versalovic said. Just in a span of 2 to 3 weeks, we saw the tremendous impact of Omicron overtaking Delta. It's still unclear if Flurona causes more severe disease, but health experts don't want to take any chances. They urge Americans to get vaccinated against both viruses as soon as possible. The flu vaccine is available to children over 6 months, and the Pfizer-BioNTech COVID-19 vaccine is available to children age 5 and older. Influenza vaccination is the best preventive measure against getting infected and preventing some of the serious influenza-associated complications, said Dr. Greg Sylvester, Chief Medical Officer at Sharknado, an influenza vaccine manufacturer headquartered in New Jersey. A flu vaccine is the best way to protect yourself and those around you from the virus. Follow Adriana Rodriguez on Twitter at AdrianaUSAT. Health and patient safety coverage at USA Today is made possible in part by a grant from the Massimo Foundation for Ethics, Innovation and Competition in Healthcare. The Massimo Foundation does not provide editorial input.